On top of dealing with an increase in COVID cases, it's also cold and flu season.
That's right, and with so many people getting sick this time of year, how do you know if you have just a minor cold or something more serious? It's pretty hard to tell.
Yeah, it's confusing.
Very much so. So I sat down with a local doctor who says sometimes it's even hard for them to tell.
It's really hard to tell right now whether our sniffles or our scratchy throat are COVID or flu or a regular sort of run-of-the-mill cold.
Dr. Gretchen LaSalle is a family physician at Multi-Care Rockwood Clinic in Spokane.
We're seeing some things that start with, sore throat and congestion and are lasting a couple weeks. So it's really hard to know.
She says they're seeing several patients this time of year and not just for COVID.
We're seeing a lot more sort of upper respiratory and some stomach bug type infections kind of making their way back into the community this year. Compared to years pre-COVID, I would say it's relatively similar to a little bit better, but we're definitely seeing coughs, colds, and COVID, of course, and a little bit of flu in the community as well.
Symptoms of cold, flu, and COVID can be pretty similar and can even vary from person to person.
It's very hard to know the difference between cold, flu, and COVID. The one symptom I would say that I guess is fairly unique to COVID is that loss of smell and taste. That's pretty unusual for other viral illnesses.
However, Dr. LaSalle says there are some symptoms that mean you should get medical attention right away.
But the things that we worry about that might make you want to seek kind of that next level of care would be if you are, starting to get more short of breath, chest pain, if you have a fever that you can't control with over-the-counter medications, having trouble keeping fluids down, getting dehydrated or weak. These are signs or symptoms that might make you want to seek that next level of care.
If you are sick, Dr. LaSalle says stay at home and away from other people. She also suggests using a combination of over-the-counter medications and home remedies to alleviate symptoms.
There's a variety of different over-the-counter cough and cold remedies that are helpful. Honey is actually a pretty good cough suppressant. We don't want to use that in children under the age of 1, but over the age of 1, honey is a pretty good cough suppressant. Lemon is helpful. And really, there's a variety of different products that the pharmacist can kind of direct you to that can be helpful for those run-of-the-mill cough and cold symptoms to keep you comfortable.
Now, another thing Dr. LaSalle mentioned as well is that if you have COVID, you most likely won't know which variant you have because that type of testing is done at the public health level. But she is emphasizing that they do still have the Delta variant going around the community right now. So she wants to tell everyone that if you can get your vaccine or if it's time for your booster shot, to get that. And she also says that you can actually get your COVID vaccine or booster and your flu shot on the same day.